Hi everyone, welcome to this podcast from the Open University for the NHS Confederation Conference. I'm Phil Kenmore, Director of Public Sector Business Development, and I'm joined by Professor Sam Bowen. Sam, would you like to introduce yourself?
I'm Head of School for Health, Wellbeing and Social Care at the Open University, which includes nursing and social care and social work. I'm also a Professor of Social Work.
Fantastic, thanks Sam. And I'm Phil Kenmore, just to say that again, I'm the Director of Business Development for the Public Sector for the Open University. Today, Sam and I are going to talk a bit about education for nursing and social care and social work and all of those things connected with that, and the future of how that sort of education is going to work and what's changing in the way that we educate people as they enter the professions. Sam, we thought we'd perhaps start with just talking a bit about how we think nurse and social care education is evolving. I mean, what are your thoughts on how that's happening at the moment?
Well, I think overwhelmingly it's moving at a very fast pace is the first thing, and it's fast paced for educational providers and it's fast paced for employers actually in terms of what the pandemic has actually taught us. It's really taught us to value our health and our well-being and our social care needs. It's also then put a spotlight on issues around how we train and educate people for the future to support people to have good health and well-being. And I think if anything that has come out of COVID, it is the recognition that actually we need to invest very heavily in nursing and a lot of allied health professions, but also in social care and social work, and to make sure we're joined up between those things. So from a practice perspective and a clinical perspective, I think we really need to operate in an integrated way and be very future focused. From an educational perspective, it's taught us that we have to do things differently, because we did have to do things differently. Fortunately, being at the Open University, we already did things differently. And that was the value that we were able to bring during the pandemic, and that meant that we were able to open up a lot of our learning resources free of charge to help people cope with pandemic, and whether that was for a nurse or whether that was for a social care worker in a registered home environment, we had free resources available very quickly. It also meant that we had to change our delivery models for education. Now, most universities are doing a blended approach, which means blended classroom and also blended online. The Open University was already blended, but it was blended in a different way. So it was blended that it was predominantly online, but actually with some face-to-face, particularly around nursing and social work. So in that sense, we've all had to change, but we were slightly ahead of the curve on that change. So what we've had to do then is take it further. And in our conversations with employers, we've then begun to think about, well, what do we really need around recruitment and importantly, retention of the workforce?
And it's interesting, isn't it? I mean, from an Open University perspective, we've seen demand go up very significantly because of our model, but we know that's happened across the board, of course, in nursing, for example, across the whole country. But it's interesting, we've seen demand go up where people are much more interested in the idea they can study in a different way for those professional qualifications and enter the profession in a way that helps them study locally, helps them stay locally, helps them, train in their local NHS trust, for example, or in their local social care provision. And that actually makes quite a difference to people, doesn't it, in terms of the way our model encourages people.
Yeah, absolutely. And I think the local is the term, isn't it? It's localism, really. And that hits employers' issues around recruitment and retention. But it's not just about being local. I also think increasingly employers want to retain their workforce and they want that investment at that level. I think the days of sending people off to go and get trained miles away, or the days when you would just accept new candidates through a recruitment process, are beginning to change, because employers want that longer term investment, which means they want to retain and recruit and promote their own staff, which therefore means as an educational provider we've got to be a bit different, so that we want to move away from this idea that it's a throughput where we train people and they can go anywhere when actually what we want to do is really support employers around that recruitment and retention, and to do it differently, and also to recognise employers' skills. Traditionally you'd get employers come in and do some sessions, help support the learner around their practice element, but actually what we really want to do is, from an employer's point of view, think about, well, what skills can you offer? How can your skills inform our curriculum? How can that support your CPD requirements of your workforce? How do you then develop the practice related skills for nurses there? And how do we support you in developing your clinical skills through our research and knowledge exchange capacities?
And if we'll come on in a moment to talk perhaps about partnerships, and how we can build partnerships to help with this new model of education, because I think that's a very deep, meaningful change that's happening, particularly through the pandemic. But I'm interested, first of all, just to touch on perhaps some of the transitions in technology that we've seen as well, because there's been quite a focus, hasn't there, on digital innovation. Health Education England have commissioned a new blended nursing program specifically to drive digital innovation and more digital learning. And we've talked about, and we've seen with our own university, the development of virtual reality in terms of how it can be used in terms of teaching. There's also some augmented reality happening in some of the other professional regulatory programs that universities are leading on. How do you think that's changing the nature of education for us now with our students, but also where it might go? What's your view on that?
Yeah, gosh, that's a big question, Phil. I think there's two aspects to that question. Is how can it help inform learning? So technology is a pedagogic approach to learning. So augmented reality, simulated practice to help people develop skills is one way of learning. You can also do that around the theory and knowledge elements of a nurse programme. There's that element. Then there's actually digital technology that actually allows practitioners to use digital technology in their everyday practice. So I think it's quite important to distinguish between the two. What we're doing at the Open University is we've just had a huge investment from Health Education England around the simulated practice element. Now, what I'm keen to do as head of school is to ensure that we have a strategic approach to the development of simulated skill activities. It's not just one-off kind of juicy, fashionable technologies that we're looking at, that actually we begin to identify the whole range of skills and learning that is required at the point of registration. So when a nurse goes to register, what is it that they're required to do? And therefore, what technological and simulated practice can we develop across the whole range of those skills, and that they're mapped against that? I've previously been involved in pieces of work where people have taken a piece of technology and thought, oh, that really suits here. And it does suit a particular clinical practice, but they haven't sat back and looked at the whole. And really, the advancement and innovation around digital technology and also around simulated practice is about sitting back and taking the whole. And how do you learn all this online with employers together to deliver something quite different? But Phil, you mentioned there about HE, the blended learning degree. I don't know if you want to comment on that, because that has got some digital focus on it.
It has, yeah. And what's really interesting in that we've seen in that is Health Education England have taken a very clear view from day one that they want that programme to be different. They want it to be, to lead on giving people digital skills, giving the nurses of the future, adult nurses in the case of that programme, the digital skills they need to work in the health service of the future and work in a way that's going to, actually give them the ability to operate in a digital future. I think what's interesting for us, coming from the Open University, we know already that we're at the forefront of this change, of this transition into new technology, new digital way, new digital ways of operating for our students. We've been doing it for many, many years as a university and trying to be at the front edge of that. But to have a programme that Health Education England have specifically commissioned, where we're working in partnership, in our case, with the University of the West of England and with Middlesex University, as three universities come together to deliver one programme together. So for Health Education England to commission that from us alongside a number of other universities, where we create a programme that focuses very specifically on the learning environment for those students, so they can learn in a way that will position them with the skills they need, digital skills and other skills, practice skills and all the rest, to be nurses of the future. I think that's fantastic. It's a great opportunity for innovation. I know Health Education England are moving on to other types of nursing, for example, and other programmes along the similar route. So it's a great opportunity for us.
Yeah, and I think what's really good about that model, Phil, is that actually by partnering with other universities and having the practice element of the programme delivered more locally, what you're getting is localised clinical skill development for local populations, and that's the key, that's the strength, and that's the innovation.
So it's a good example, isn't it, of how we can move on to talk about partnerships, because as you just said there, what we're doing in our programme with University of West of England and Middlesex is that, the Open University is providing the core curriculum, and students are doing their main academic study with us through our digital environment. University of West of England and Middlesex locally in London for Middlesex, and in the southwest of the University of West of England, are managing the practice elements, the placement elements, and the skills development, and some of the academic content that goes around it. So we've localized that part with a central curriculum delivery from the Open University. There's opportunities now for us to do that differently with employers in different localities, and to have partnerships that draw the university and big employers together to think how we do that locally. And we're working on some of those. For example, we're working with Oxford University Hospitals Trust. Hopefully we'll hear from the Director of Nursing there fairly soon. But do you want to say a bit about how those partnerships with large employers might work to reshape the way we deliver nursing, social care and other education?
Yeah, definitely. And it kind of goes back to the first question, Phil, about what's different. What's different, really, we're following the pandemic. And I think fundamentally what's different is that employers are looking for longer term investment, both in their workforce but also with other organisations. I think we've moved a little bit away from scale, which is what we were delivering before for lots of us, and more towards a meaningful partnership. Now, nursing, social work, social care have always been delivered in partnership to a greater or lesser degree, depending on local arrangements. But at the moment, I think employers are much more specifically wanting to embed long-term relationships with defined partners to achieve long-term objectives, strategic objectives. And one of the ways we're thinking of doing that at the Open University is by something called the Nursing Academy model. Now, that can mean lots of different things to lots of different people. And what we're trying to do is to use that as a term that we start developing a partnership around it. So it won't be the same for every organisation because it has to suit the needs of the local employer. But in essence, a nursing academy is a structural delivery form to allow that partnership to develop. And it's a partnership that in essence is about excellence in clinical skills. It's about promoting high quality teaching and learning. It's also about ensuring that recruitment and retention are undertaken in a partnership way. And it's also about underpinning all that clinical excellence through good research and good knowledge exchange and good scholarship. So for us as a university, it's about bringing all our functions as a university and also our scope and maybe our networks and our context and our powers, because we have a lot of power around research funders, into employers and saying, this is what we are, this is what we've got, and this is what we can offer. So we've had some interesting conversations with a number of employers around that model. And what's emerging is that very much employers, A, want that model. They want to invest with either one or two or three large providers, and they want that investment to be over a longer period of time. Now, majority of those partnerships start with training and education of the workforce, which is great. But actually that in itself has been quite interesting. So instead of coming along as a provider, employers are actually saying, no, we want our staff to be much more heavily involved. So they're moving, in addition to delivering the practice curriculum, the skill development work, they're actually also getting involved in the theory modules and beginning to teach the theory, which in turn informs academics when they write the theory model. So that's the start of some of the conversations.
And that's really interesting, isn't it, from a perspective of thinking of the Open University model and our inherently blended approach. We're blending it together there with the employers so that it's co-delivery and it's effectively co-curriculum, development in the future, potentially together, and that will span across the research and all of it then comes together.
Yeah, it does. So if we move into like a co-produced kind of context, and whether that's around the curriculum, we've also had conversations about underpinning that with research and doing co-production around research, which we align to the strategic objectives of the NHS Trust that we're working with. It also helps support the retention of staff who want to get involved in research in that way, and it's that co-production methodology really that allows it to be sustainable.
And I think the other thing that I found interesting in the conversations we've had with employers, that there's a number of different versions of this model. It's not a one size fits all, as you just indicated, the fact that locally you can shape the model to suit the local conditions. So I know, for example, we're having one set of conversations in London where there's a large employer who is interested in drawing in people to be recruited into things like nursing associate, for example. Those students will be normal students. They'll be paying for their own tuition, as it were, as a normal student would. but the employer will support them and offer some element of funding towards that, perhaps in year 2, but also then may guarantee them a job, so that they're recruited locally, they focus on local communities, they focus on the widening participation agenda and drawing people into them as an employer locally. They guarantee them a job and keep them locally.
Yeah,
so you get that retention.
Yeah, and it is a really good example of that, because I think there are some pressing areas nationally where retention is a big issue. We've also got another example where we've had an employer, a private employer, approach us who want to develop nursing in a social care context. So we're developing this partnership model, an academy with them that actually tries to sustain nurses in social care, which we know is a huge issue. But we've also got the other end, and the other end is one that we're just moving into, but it is really interesting, where NHS trusts have developed their own curriculum. And they're then coming to us to say, will you validate our curriculum, or will you look at it for us and see how it fits in with what you're doing, so we can provide a career pathway. So there's a whole range of opportunities out there.
And it's interesting, isn't it? Because think of the range of the models. And then, I just mentioned an example that was about direct entry students essentially self-funding and the employer supporting them. At the other end of that model, of course, you've got apprenticeships, and the Open Universities, the country in England is the largest apprenticeship of the registered nursing degree apprenticeship, for example, the largest provider of the registered nursing degree apprenticeship by far. Lots of people are choosing us for that route. Lots of employers are choosing us for that route. And of course, so you've got an option there where these models can still work, but in that case, the employer is using their apprenticeship levy to fund that education for that student. They've got a job, they're working whilst they're doing it, they're earning whilst they're learning, and they've therefore got other opportunities to stay in their community. They don't have to travel for the academic element of the programme. They can stay living where they are, they can support their local community, and the retention levels are bound to be far higher, as we're seeing already on the back of apprenticeships.
Absolutely, and I think the most important thing that underpins that, Phil, is that sense of widening participation for our local communities. Because the most important thing around health and well-being is that your neighbour is connected to your auntie, to your son, to the child who visits the school, and therefore keeping a workforce and allowing opportunities for local communities who form your local workforce is an absolute essential.
Yeah, I think it's, and again, just going back to the breadth of the model that we apply, when you think about the impact of things like Brexit potentially on international recruitment, the ability to recruit internationally, and of course the pandemic. I know Brexit seems like history now, but of course it was immediately pre-pandemic in terms of the impact on things like that. The underpinning workforce demands for health and social care are immense at the moment. They have been for ages. Even pre-pandemic, we knew there were problems. There's an element of these models that will support and help support the country grow that workforce without having to be reliant necessarily on as much international recruitment, if that continues to be a problem. And also potentially will drive that workforce recruitment in a better and more sustainable way than perhaps some of the other models we've had in the past, where people felt they had to move to go to university and they had to have that distant connection and relocation and so on. So we're hoping these are models that are going to sustain the workforce growth, aren't we, in health and social care?
Yeah, and I think the other bit that I think is attractive about a nursing academy is it offers stability. So there's whether it's Brexit, whether it was the workforce retention issues pre-Brexit, whether it's the pandemic, whether it's policy change, whether we're moving towards apprentices or not, what we see in health and social care is a fluctuation of funding streams, which ultimately impacts upon the stability of the system and the microsystem and how we all work together. I think investing long term in a nursing academy allows you the stability to grow and then be able to respond much more stably to any of those changes, whether it's whether Brexit gets off the books or whether it stays in, whether we have a policy change, whether we have a new funding stream. I think it allows that stability.
And do you think we've talked a lot about thinking of career ladders and how people might, develop their career and grow their education as they develop their career, whatever their background, whatever previous opportunities they've had or not had, which is partly what the Open University is all about with our social mission. Do you think there's opportunities in these models for that career laddering in social care as much as healthcare, and the way that we can help develop those opportunities further down that career ladder, perhaps?
Yeah, absolutely. The Nursing Academy around retention and recruitment is definitely about the career framework and the career ladder. And the people that we're talking to in the NHS, it is definitely about, well, how do we support your existing career development framework, or how do we build a new one? I think it's slightly different for social care because it's a much more fragmented system in social care. And obviously, as we all know, and everybody listening to this will know, that we do not have a national social care plan, and we seem to be sidestepping it a little at the moment. But in the absence of that plan, I think as a partnership we can move forward on that, and I think it's for us to show government what a social care framework would look like and where does health sit within that. Now, we do have integrated care partnership boards and integrated care systems, and they're about to move into a legislative position that brings about further integration. What a great opportunity. So again, I'm having conversations with Health Education England about how do we then move towards an integrated workforce. Now, we've had examples of an integrated worker at the point post-qualification. So, for example, somebody who's trained jointly as a nurse and a social worker. We've done that. But actually what we've never done is look at what an integrated worker would look like just underneath the regulatory bar. So somebody who might be a social care assistant or somebody who might be a healthcare assistant, because if I was sat in an integrated care partnership board or an ICS, if I'm joining that system up, I want my workers to be joined up, and I would want a worker to be able to act as a key worker and follow the person, follow the service user, follow the patient throughout the whole system. Well, we have to do that by not only integrating the systems but also training the workers to work in that way.
Fantastic. That's a really good explanation of that, Sam. Actually, it's an interesting topic, isn't it? That's come up a number of times, but no one's really grabbed it yet. No one's really grabbed hold of that one.
Yeah.
So, good conversation about the different models, about the way it's expanding, about the change in innovation in education, particularly digital innovation. There's a real position for the OU in all of this, isn't there? I mean, we're both from the Open University. We're talking about our model. The Open University has been innovating for 50 odd years already in the way that this type of education is provided. We've been providing social work for well over 20 years, nursing for well over 20 years in terms of blended models. The OU is really well positioned for the future on this, don't you think?
Yeah, definitely. I think to some degree people might have been sceptical about online distance learning, but actually the whole world is now online, and actually we can see the benefits from it. And because we've been doing it for such a long time, we can also tell you the deficits of it, and we can tell you what we need to put in, particularly to support students, because different types of learners require different types of support in the online world. So we know that, and I think that's what puts us at an advantage around the current context. But I definitely think that we then are in a position to be quite innovative around what we want to do and to really help employers in that.
It's a fantastic point, isn't it? It doesn't come up very often, this idea that being online is one thing, but actually being effective in the way you help different types of students learn online is a very different thing. And that's what the OU is an expert in. That's what we've spent 50 years pretty much learning to do at distance education, and then online distance education. And I think what's interesting when I talk to lots of employers is explaining the difference between our academic content, particularly in nursing, social work and social care, is specifically designed from scratch for an approach that's blended. It's not designed for another approach and then adjusted to a blended delivery. And that's probably quite important in the way we design our curriculum, isn't it?
Yeah, I think in the curriculum design, I think what people don't recognise, in fact I didn't until I started working at the Open University, is that the curriculum design process has quite a lengthy and established and recognised research process that underpins, so that when we're delivering online, we've actually put it through a very extensive process that's mapped against the research about how people learn. And that's the difference, because there is a pedagogy of online learning as opposed to a pedagogy of seeing somebody face to face.
Thanks, Sam. Now I'd like to welcome our partners, Kent Community Health NHS Foundation Trust, to say something about the Nursing Academy that they run already with the Open University. I'd like to welcome Dr. Mercia Spare, Chief Nurse, and Louise Norris, who's the Director of Workforce, Organisational Development and Communications.
We provide a wide range of NHS care for people in the community in a range of settings, including people's homes, nursing homes, health clinics, community hospitals, minor injury units, and increasingly urgent treatment centres and in our mobile treatment centres. We're one of the largest community trust providers in England, serving a population of about 1.4 across Kent and 600,000 in East Sussex and London. We employ about 5,000 staff, including doctors, community nurses, physiotherapists, dietitians, and many other healthcare professionals, including admin staff. Well, like most trusts, we have vacancies for both registered and unregistered healthcare staff. Our current vacancy rate is about 4%, but we cover a really large geographical area, as I've previously said. But the majority of our adult nurses are employed in Kent. To the east of Kent, we're surrounded by sea, and to the west of Kent, we're very close to London. Traditionally, community services were seen as areas of nursing that you went into after a few years' experience, but this is changing, and we really want to change that. We want community nursing to be the career of choice for qualified nurses as they qualify.
So, as Louise has outlined, we've had a number of vacancies, and I think historically around all of our teams, but community hospitals. Growing our own enables us to have a pipeline of nurses that are engaged and actually sign up to the values of our organisation. We're able to provide clear nursing pathways. The students know where they're going to be over the period of their training. And more importantly, it opens up to a range of new people that would come into nursing that ordinarily may feel that they've missed the boat. We have people with real life skills that come in perhaps later in life into nursing, which have brilliant transferable caring skills, and that enhances our workforce. We have a pretty good vacancy rate today, but we still have areas of our business where we've always carried vacancies for a lot of the reasons that Louise outlined in terms of our geographical location and being in such close proximity to London. Community hospitals was an area that we had vacancies that were hard to fill, and we couldn't really see that changing for the future. So we felt that if we started our own academy, that would give us some control over some of those challenges. It would give us a pipeline. And also it enables us to avoid some of the competition with our kind of competitors, with our kind of located providers. And again, it provides opportunities for people who wouldn't normally come into nursing. So we're tapping into a different set of people from the traditional academic route. So because we partner with the OU, a lot of the academic teaching is online. So video clips, webinars, but also we have placement tutors, and there is an academic tutor that students can tap into. But a lot of it is done online, which suits some of the students that we appeal to because they can study when and where suits their life. So some of it, again, is online with videos and films. We have a plethora of on-the-job training. So people are working with a kind of practice supervisor. There is also the practice tutor from the OU that comes in and does some of those skills. We have an academic skills lab that the students can rote into to practice some of their techniques and certain procedures. And also they have access to our internal training. So it is quite wide and varied. From the work we've done so far, we've been incredibly successful in the types of students that we have attracted. So we may have people that have brought up a family or been caring for a relative or a loved one that have amazing life skills, but they feel that that academic boat or financially, going through an academic route is not really for them. It hasn't. They have either haven't been able to. It just hasn't been open to them at that time. So the types of students that we attract into the academy are people with life skills. They're not all sort of mature students, but I think we've opened up to a section of people within our communities, our local communities, that are invested in healthcare because it is delivered to the people they love in the area that they live. And that's been fascinating to be part of. I feel quite privileged to have some of our students all of our students in working in our services because they bring something slightly different. I think it's because we take people who are invested, do not see this career as a rite of passage sometimes, who really, really want to deliver care to people based on their own life experience.
Well, as Mercia said, the accessibility of the OU modules is online, and students can access them at a variety of times to suit them around their work and their home life and other commitments. So I think that's a real advantage. It's not set in stone. And as long as they meet the deadlines, they can allocate their time to suit their own lifestyle, wrapped around their employment with us as well. So it's a real benefit, that flexibility. Using this apprenticeship model has meant that we can tap into the local community and enable people to develop their careers without having to move, or, as Mercia said, for more mature students that perhaps wouldn't have been able to give up employment and go to university to get a career in nursing. The need for some functional skills means that the attainment levels increase in our local community as well. It's a real sustainability model. As Mercia said as well, we've created career pathways. People can come to us as a healthcare assistant, and we've now got career pathways that can take them right up to the top level of nursing. And I think that's an opportunity that's not been available to people before. The Nursing Academy, the original business case was over a number of years. We've currently got 38 registered nurse apprentices. 4 of those are learning disabilities. We've got 34 nursery associates on the programme. Our first cohort of nursery associates are receiving their pins as we speak. So, we're really proud of that achievement. We've got an intake of 25 registered nurses and 25 nurse associates planned for 2023. And we're looking further at how we might bring this business model into business as usual. And we're also looking at how we can support our other providers across Kent and Medway to see if this academy model could work for them across the system as well. It's really lovely to see the students on their first day. Mercia and I attend the inductions, to see their enthusiasm, to watch their journey, to know that our first cohort of nursing associates are about to receive, their registration is just amazing. And we've seen them mature. Our student nurses as well. Over the last year, it's been really challenging for many student nurses, but because of our partnership with the OU and that online platform of learning, their learning hasn't been disturbed in any way. So we've managed to keep them on the original timeline. And I'm really proud that our trust decided to invest in the academy, and that we have got a pipeline of people that are very committed to working in a community trust and want to give back to their local community.
They have their academic work, they have a set number of assignments that they have to undertake and pass by a deadline. They do get a couple of attempts at doing them if they don't do so well the first time. So they have their kind of academic section. They have their induction. They do on their induction day. I love it. I absolutely love going to speak to the new students that come into the academy. And I always ask them, okay, who am I keeping my seat warm for? And there's always some of them, both students and nurse associates, that say, I'd like your job, please. So we do quite an intense induction. But then in terms of their clinical placements, they have a whole programme set up. So they spend some of their time working as part of a local team because we're growing our own. And then they will have periods of time over the either the 2 years or the 4 years that they're out on placement learning new skills. They'll have a practice assessor, there'll be an academic tutor, and there'll be a practice tutor who will also come in and help them in terms of gaining their skills, some of the theory around care delivery, anatomy and physiology, and they also get to spend some time in the skills lab. So it's quite a packed programme for them, both the nurse associates and the registered nurses, but it's set out and they know where they're going to be in terms of learning different skills. I mean, KCHFT run over 70 services. We literally run from cradle to grave, I guess you could term it. So they get to work with our health visitors, working with newborn infants, and they also get to work in our community hospitals and out in the community, caring for people that are at the end of their life and learning how to do that well. So it's quite varied, similar to an academic pathway through a traditional university route, but they know the organisation, they have a wider network because they're part of KCHFT all through. So I think it's twofold, really. I think it enables them to broaden their both academic and clinical skills. They get to work with experts by experience. They get to learn what it's really like to work in community services and how that non-traditional secondary care route is very, very different. So working in community services, the infrastructure in community services is very different. And I think what we expect from our clinical professionals in community services is more of an independent practitioner. So they get enormous skills working with independent practitioners that don't necessarily sit in that medical model. That's the same as in secondary care. So it's quite unique. They get to see that actually community services is the glue that keeps all the other parts of the NHS together, keeping people in their own homes, living well within their communities, supported by the people they love and in a surroundings that's familiar to them. But also, I think it gives them different choices when they qualify, not only the plethora of services that we deliver, but also within the NHS. They get a much broader view, I think, of how the NHS itself and local systems work, being in a community provider. And I think throughout their career that will be beneficial to them, given the way that the changing infrastructure of the NHS is set for the next few years.
Thanks very much to Dr. Mercia Spare and Louise Norris from Kent Community Health NHS Foundation Trust for joining us today.